Hello, my village people. It's Dr. O'Kane, your village doctor. I've come again. So I just thought I'd come online just real quick to just talk a little bit about resistant hypertension. Okay, some of you, your blood pressures are always running so high. You are actually taking a blood pressure medication already, right? Say for instance, you're on amlodipine, 5 milligrams. And you've been taking this for quite some time now. You checked your blood pressure again, but it's still running high. Now your doctor tells you to start a second blood pressure medication. You do that. You're taking, say for instance, lisinopril or losartan, and you're taking that second blood pressure medicine basically, and you've increased the dose. So now you're taking 2 blood pressure medications. You check your blood pressure is still high. It's still staying high. Now you decide to add another blood pressure medication. Okay, so you add a 3rd blood pressure medicine, and now you're taking 3 blood pressure medications. And regardless, in spite of that, your blood pressure is still high. Of course, it's coming down a little bit, but it's still high, meaning your blood pressure is still running in the systolic in the 130s and above, or in the diastolic in the high 80s to 90s. That's the low number. So when you have this circumstance, you have to begin to think about something called resistant hypertension. Resistant hypertension is when you're taking multiple blood pressure medications. So the actual definition is 3 blood pressure medications that you're maxed out on 3 blood pressure medications, with one of them being a diuretic. If you have this, you have resistant hypertension. Patients with resistant hypertension, right, will need to figure out why they have resistant hypertension, because you have patients that many people have, just your regular good old high blood pressure hypertension. They require 1 blood pressure medicines, they bring their blood pressure down, right? But some people require multiple blood pressure medications, like I said. And if that is so, then you have resistant hypertension. There are multiple different causes of resistant hypertension. If you fall in this category, we have to do some more testing. Some more tests. Some of these tests that we have to do will include things like checking your cortisol levels. We may have to check to see if you have sleep apnea, for instance. We may have to check to see if you have certain tumors, certain cancers that can cause elevated blood pressures. One of them is called pheochromocytoma. We might have to look into hyperaldosteronism, or an aldosterone producing tumor. We may have to look into things like renal artery stenosis, which, can happen. We may have to, just look at all these different things, look at multiple different causes of high blood pressure, right? And so my appeal to you guys today is, if you're one of these people that requires multiple blood pressure medicines, the answer is not to stop your blood pressure medication. The answer is to talk to your doctor to figure out why your blood pressure is still remaining high in spite of being on 3 blood pressure medications, especially if one of those blood pressure medications is a diuretic. A diuretic could be medication like hydrochlorothiazide, furosemide, clothalidone, one of those kind of medications, right? If you're on one of those and your blood pressure is still running very high, then we need to figure out why that's happening, because we want to be able to address the root cause of your high blood pressure. Okay? Does that make sense? I hope that makes sense. I wanted to just I know we talk about high blood pressure a lot, but we never really talk about, more complex cases where patients are requiring multiple blood pressure medications, which is good for them. They need to be on that to keep their blood pressures down, to reduce their risk of heart attacks and strokes, remember? But we need to figure out why they're having these high blood pressure episodes, okay? All right, that's all. I wanted to just jump on for a second. This is a long form video, but I hope this helps. And if you have any questions, I know I see a lot of questions on my DM. I don't get a chance to get to them. I'm sorry. I will try to respond to the questions as I can get to them. But I love you guys, and I'll talk to you later.